Hello, I'm Dr. Cooper Brookshire. This is a step-by-step where we take practitioners through important veterinary conditions and issues step by step. Today, we're talking about canine infectious respiratory disease complex and when antibiotics are indicated and when they aren't. This algorithm will walk you through history, symptoms, supportive care, and treatments.
This video is sponsored by MERCK Animal Health, makers of Novavax Intratrac Oral BBPI, the first oral Bordetella bronchoseptica and canine parainfluenza virus vaccine with patented immunomister technology.
In today's step-by-step algorithm, we break it down into four major components: history, supportive care, diagnostics, and treatment. The first step in using this algorithm is determining which patients can get the most benefit from it. Those patients are ones with a history of contagious acute respiratory disease. That's going to be dogs that go to dog shows or have recently been boarded, even a veterinary visit, a grooming visit recently, or dogs that have been recently adopted from an animal shelter. And dogs with those symptoms, particularly ones that are otherwise healthy and don't have underlying illnesses such as heart disease or neoplasia or issues that affect their immune system. The clinical presentation typically includes coughing, sneezing, ocular nasal discharge. Keep in mind that many owners present with a primary complaint of vomiting when in fact these dogs are actually coughing up foam, and the owners make that mistake. In patients with a history consistent with non-contagious etiology, or in those patients with a high risk for severe disease due to underlying conditions, further diagnostics should be pursued to determine a treatment plan, and this algorithm really shouldn't be used. So a dog that lives alone, that hasn't traveled, hasn't boarded, suddenly coughing, probably not a good candidate for this step-by-step. There's so many other explanations other than a contagious virus that should be considered and should be evaluated with a diagnostic workup. In patients diagnosed with this, supportive care is always important for successful outcomes. Nutritional and oral hydration support can be accomplished by feeding wet food, which tastes good and has increased water content. Nursing care, such as removing dried ocular nasal discharges, can be really helpful for dogs that are uncomfortable. Steam therapy is indicated if secretions are thickened or if dogs are coughing. This can be easily accomplished by owners at home by using a small bathroom and closing the door and turning on the shower with hot water. The next step is to determine if antibiotics are indicated and when further diagnostics might be needed. Duration of clinical signs and evidence of systemic illness are the two primary aspects of the case you should analyze at this point. In patients with a duration of disease of 10 days or less, you should evaluate for evidence of systemic illness, such as lethargy, fever, or anorexia. If any of these signs are severe, you may consider a further diagnostic workup. If signs of systemic illness are more moderate, first-line systemic antibiotic therapy is indicated, and usually you would want to use doxycycline or amoxicillin clavulanic acid if doxycycline is unavailable or contraindicated for some reason. In patients with a duration of disease greater than 10 days, antibiotic therapy is typically indicated even if evidence of systemic illness is not present. And again, doxycycline or amoxicillin clavulanic acid are our typical first-line drugs here. In patients with a duration of disease of 10 days or less that do not have evidence of systemic illness, so these are patients that feel good, they're eating well, they're playing, they're acting reasonably normal, antibiotics aren't indicated. We're following our human healthcare practitioners, and that many people, when presenting to urgent care with bronchitis, no longer receive an antibiotic, and we're seeing a similar trend in veterinary medicine. A core element of antibiotic and antimicrobial stewardship is preventing diseases in a way that doesn't require antibiotics. We call that advocating for a system of care that doesn't need antibiotics. Simply maintaining a preventive health care schedule and program that successfully keeps animals from getting sick is the best way to not need an antibiotic. And for canine respiratory disease, there's no question vaccination is the most important tool to prevent disease. General treatment is indicated in patients whether or not they receive an antibiotic and often includes antitussive therapy, avoiding neck collars, and limiting exercise. You should advise owners to avoid neck collars and limit exercise because both of these can elicit and exacerbate coughing. There are many different antitussive therapies. Opioids are the primary class of medication used as antitussives in coughing dogs. Hydrocodone and butorphanol are two of the most commonly prescribed drugs. Other medications that have recently emerged as potentially useful include meripatin, tramadol, and sometimes corticosteroids. However, corticosteroids are typically reserved for non-contagious etiologies of coughs. It is important to note that if a patient has any evidence of pneumonia, antitussives are considered contraindicated. You should advise owners to monitor for worsening symptoms or failure to improve. If clinical signs fail to improve after 10 total days of illness or worsen at any point, a further diagnostic workup is indicated. Some examples of further diagnostic tests you may consider include chest radiographs, heartworm disease testing, other parasite testing, and even bronchial lavage. Thank you for joining us, and thank you to Merck Animal Health for sponsoring this edition of Step by Step. More resources on canine upper respiratory infections can be found on vetfolio.com.